All right, Claire. Clare Bannon is a clinical nurse leader at St. Paul's in Transplant, and she's going to talk about the toolkit that we have available for.
I forget which one I'm supposed to use. Thanks, everybody. Thank you so much, Melissa. That was really great. So this is a work in progress. We're just sort of putting this together in the last few months on a toolkit that we can give to kidney care clinics, that it's sort of standardized a practice. So there are a couple of key sites that you should visit in the kidney care clinic. And the first one is the BC Transplant website. So on that website, you'll find PDFs of these 3 books, which I'm sure all of you have seen, the step-by-step. They should be all available to you in your kidney care clinics, in your PD clinics, in your hemodialysis clinics, and definitely in the transplant clinics. So these have been very helpful. They've been a work in progress. If you think that any information needs to be changed or added, contact Peggy at BC Transplant Society, and we can definitely edit this information. But these have been really a great first step as our tool. Much needed. There's also on there on the BC Transplant website, and I won't go through each through the website, but take a look in there at this link, and I'm going to provide everybody with a sheet of the links that I'm going to go through. And then for the folks that are on the webcast, we will email that to the renal managers, all of the links to disseminate to you. But there is a YouTube channel with our stars from this province, many of are in this room, that did a video on the step-by-step process through the living donor and transplant process. So have a look through that. A great site. Also lots of great information about transplant organ donation on the BC Transplant website. That should be your #1 go-to place. Now, what do I do? Our second partner, these are another area for our renal patients another place that they can go to is the Kidney Foundation. So Kidney Foundation of BC and Kidney Foundation of Canada. And also kidneyfoundation.org, which is the US one. There's information about the LODER program that was mentioned today, living donation, and also living donors on how to ask. This was a tip that Sharon actually gave to me yesterday that I wanted to include. So lots of good information on this website or on these 3 links. Another partner is the BC Renal Agency. So this was some of what Monica was showing about the education. So again, it's standardized about the different modules, especially the one on transplant. And I've stolen all of these logos. Another website that was researched through our social worker at St. Paul's, Allison, who's not here today because she's gotten married, so I'm not even sure what her new last name will be, but she's a key part of our transplant team, is transplantbuddies.org. So it's a discussion bulletin board site for recipients and donors, and this is a US-based site. Another one is TransWeb, a non-profit serving the world transplant community. Is really aimed at young people, and there's discussion forums on that as well. Another great website with lots of information and videos and patient information about the living donor process, recipient process is the UW Health, University of Wisconsin. So another link. So some very well-prepared patient education videos, but again, US-centered. livingdonorsonline.org. It's specific information about those considering organ donation. Includes questions and answers and talks about the process. Explore living donation. So this is another key of you may have gone to the provincial the provincial nephrology rounds and heard Amy Waterman speaking. She's developing has developed a whole module, an education module about living donation. It is US based. Fortunately, Ontario is modifying it to be more Canadian based and refining it for their program. So that should be completed in June, and they've promised to share that information. So they'll do all the work and expense, and we'll reap the benefit. YouTube, so lots of information on YouTube. Another link about a woman who donated to her friend. Another one about a patient talking about being a living donor at age 83 and why he wanted to be a living donor. Another great story is about a woman who received a kidney from a stranger within her network. Stranger, still within her. I think this is the story that you were talking about, where the woman entered the store and it happened to be her friend. And then there's 3 TED-type talks that we found, and also Allison keyed me into, one from a physician, a donor, and a recipient. And also, if you have any other links that you want to send to me, let me know. Another thing that we give out, for every patient who is a living donor, and Melissa, you would have gotten one of these, is a nice blanket that we give while the patients are recovering in the hospital about 2 days after. It's just a really warm, fuzzy, comfy blanket. It's well appreciated, I think. Saying thank you in many different languages. And also a thank you card is given to the donor with a pin, recognizing that they have been a kidney donor and that they've given the gift from BC Transplant. And that's it for my little toolbox. But again, it's something that we're working on and hope to develop and get that to you all. And with our partners at the Kidney Foundation, BC PRA, and BC Transplant Society, VGH, St. Paul's, and Children's, of course. Good. It's under 50. Is young, yeah. Good.
Are you encouraging people to go on Facebook? Is there templates for telling their story on Facebook for people, or?
I think people are. We don't have any templates, but that's an idea that we're exploring on just some guidelines around that in terms of education. I mean, 5 years ago we said, no way, don't go on Facebook, but I think that's changing. It's changing. Yeah.
Available to help them?
Yes, we have donor outreach letters, both VGH and St. Paul's, and right now Allison and Carolyn are in the midst of standardizing, so it's the same for both and information for both sites, but maybe you can address about identifying an advocate.
We would certainly talk to them and answer any of their questions. As I mentioned when I was chatting too, we just want to make sure that the advocate is, or the spokesperson is also educated on donor outreach and on the same page as the recipient when doing the approach. And so we can either have the advocate spokesperson call and speak to one of our donor coordinators or a social worker, or the recipient can pass on that information. In terms of identifying a person, it's usually, it has to be someone that the recipient trusts and trusts getting the word out for them, and feels that they can work with, that there aren't dynamics in that relationship that are conflictual or will work against them. So I think recipients usually know or have somebody in mind or a few people. So it's more about the recipients asking questions about, you know, and often there'll be a team already, like how do we do this and how do we make it work? And it's addressing any of the concerns the recipients has, and also just having an open conversation.
Jody, do you have anything to add to that? Okay.
Yeah, it really comes from the recipient themselves.
Well, I think from talking with the recipients, it often turns out to be someone who's already come forward as a donor and hasn't been able to proceed for whatever reason, who then steps up as an advocate or champion for that particular recipient.
So now we come to our question and answer period. You have the experts here in the room, so if anyone has any questions that haven't been answered today, please let us know. You can also email us. And again, we want to set up that communication with the kidney care clinics, with the hemo units, with the PD units to help you navigate transplant with your patients. That's what we're here for. So pick up the phone and call us. Yeah, I mean.
Thanks. Actually, I'm going to sort of follow on that question to Caroline as well. So when you're speaking to helping with the donor outreach, do you speak individually to them, or we're just starting to get into, so I'm asking the question now, but do you organize it in small groups, or do you speak individually to the patient who is wanting to do donor outreach? And do you sort of in one session cover everything that you have, for example, the letter that you talked about, going onto social media? What's the depth of your meeting with the person?
And Shelley might also want to comment. Shelley sees a lot of the recipients and assesses them pre-EGH. I think it really depends on what the recipient needs. And so, and also our transplant coordinators at BGH also do donor outreach discussion and provide material. So often the idea of donor outreach, it's a process as we've talked about. So it really depends on their comfort level, how much information they have, or where they're at in the process. But it also is on what that person needs. So whether it's them as an individual, whether they've brought family with them. Certainly when we do group education sessions, St. Paul's or BGH, we'll talk to groups about donor outreach. So it takes all various forms, but we work with each recipient individually to meet what they need, and it's a process. So it's, you know, some recipients are comfortable with donor outreach from the beginning, and they just need some support and some tools, but they're comfortable with the idea of it. And then others, it's more of the process of working through some of the other issues. So I don't know, Shelley, if you want to add anything.
No, and I just think the pre-assessment day is kind of overwhelming for patients. They receive a lot of information, and so sometimes recipients just want to know that they're medically, eligible, to receive the transplant, and then take the next step with donor outreach. So, like Karen said, it's just an individual approach, and just sort of start where they're at with things.
I just have a question for you guys. I'm trying to wrap my head around this. I have to admit, I haven't been referring older patients for transplants, so I'm wrapping my head around where I got off track. But so I'm wondering, what about vascular disease? So in terms of peripheral vascular disease and that sort of thing, when is the outcome not as good? Do you have any kind of guidelines around that, if they've had stents before, or?
So when I'm talking to people and they say, why wouldn't I be a transplant recipient? And, then we got past the obvious, like, you have cancer and things like that. I say it's your heart and it's your circulation, but not necessarily in that order. So peripheral vascular disease and, with all the complications that come with that, so many diabetics, with diabetic feet, certainly an open ulcer would be an absolute contraindication to a transplant. But where the surgeons go is the iliac vessels, and so what we invariably ask for is a CT, a plain CT without contrast, to look at iliac calcification. And if the iliacs are heavily calcified, the surgeon will just say, I just can't do it. It just becomes a technical thing. If somebody already has claudication and bilateral claudication, and we worry about, even if we could do it, we create a further Steele syndrome. So a lot of blood's going to go into the kidney, so that would be a contraindication. So peripheral vascular disease is another biggie. And oftentimes when we're doing our pre-transplant, going through it, that's the thing that rules them out.
It is,
Yeah.
okay.
Yes.
Can I ask, our focus is obviously on live donor transplants. Are we at a place that the deceased donor organ retrieval is okay, or do we have a part to play in that part of the education as well?
So in terms of the general population being knowing about registering their intent, absolutely, the two go. I mean, the two go together. So most people, it's much easier, I think, for most people to get their head around being a donor after they've died than it is while they're still living. And so certainly, absolutely. And Peggy can speak to the registry. We certainly, I think one of the focuses in a KC should be about education and about the donor registry and people registering their intent.
And are the deceased? Well, I guess maybe what I'm looking for is, are we still getting enough deceased donor organs?
Well.
I understand. I know that, but have we?
We're doing better.
Yeah, we're doing better.
We've done better with deceased donation for sure. BC Transplant has made a huge impact, I think, on the waiting times in our donor numbers. And over the past 5 years, we've gone to the worst in the country to pretty close to the top in the country. I think our challenge is, and our success will be, when living donation and deceased donation seem to go in opposite directions. So in jurisdictions where there's a very high deceased donor rate, there's usually a low living donor rate, and when there's a low deceased donor rate, there's a high living donor rate. So we've had a high living donor rate, maybe because we had a low deceased donor rate. Now our deceased donor rate has actually exceeded our living donor rate, and so our challenge is to keep them both up. So, you saw the number of patients who have end-stage kidney disease or are in need of transplants. We're a long way from meeting that need, even if we continue to rise those. So it's going to be a long time, I think, before we say we have enough of one or we have enough of the other before we say we don't need either. So, but I'd really love to see us grow them both.
And
in
terms of referral, if you know that living donor is not going to be an option at all for somebody, sometimes their deceased donor, the possibility of deceased donor might be actually very high for somebody depending on their blood group. For example, if they're blood group A and they're over 65, they'll get transplanted pretty quickly once they start dialysis. So there's that as well, and that's information that's important too. And then, of course, if they're highly sensitized, their chance is less, but they also need to be referred to be in for a chance to get matched. So, and then, of course, if they don't think they have a living donor, and then we have that conversation several times with them, somebody might pop up. So it could be either living donor or deceased donor at the end of the day.
Peggy, do you have something to add?
Yeah, I just wanted to add that the work that BC Transplant on the donation side has been doing around the province really is about trying to change culture in the province to one where we have a culture that embraces organ donation as a normal part of end-of-life conversations when it comes to deceased donation. So we didn't talk about that a lot today, but certainly in the work that you do, you can help to lend a hand and spread that message.
Yeah, I'm not really sure who to direct this question to, so maybe the whole room. Dr. Gill, when he did his presentation, there was a very brief snapshot of ethnic variation in transplants. And I was just wondering if anyone can, the representation for Aboriginal Canadians in terms of what percentage of those that have chronic kidney disease actually receive transplants or enter the transplant process in comparison to Caucasians or other ethnic groups. And if it's lower than their representation in the disease, what can we do to encourage and increase transplant rates for Aboriginals? Oh, I think I have to turn mine off.
I mean, it's a very good question. Certainly, certain types of kidney problems are higher incidence in that population. The living donor transplant rates are less in that population, and that's something we definitely can work on. Again, a cultural thing, also because there's a lot of diabetes, etc., in their relatives. So, you know, people who are potential donors might not be able to come forward. Discrepancies would be living donation is less in that population. Deceased donation rates, it's equal as any other racial group, apart from perhaps if there's blood group discrepancies. Their access to transplant workup is the same. Now, in other countries where access is influenced by culture and by races, etc., because of healthcare costs, that's a problem. But here in Canada, we're lucky in that our healthcare system is open to all. So we kind of have less obstacles there. But certainly I would think that there's a big discrepancy in living donation in that population.
Sorry, yeah, play the game. I work at the Nanaimo Kidney Care Clinic. I'm the social worker there, and we serve a lot of the Northern Gulf Islands and a lot of more remote communities for First Nations on reserve, and we've found that a lot of times in our clinics we have no shows, and it's hard to reach people via telehealth sometimes. There's less ability to access based on, you know, just time to travel, and I guess I wonder if there's this. I mean, I guess it wouldn't be a massive, significant population, but every life matters, and you know, if those remote communities people are missing opportunities or missing chances just based off of healthcare access and how we can engage them in the process.
Sure. Again, I'm sure it's more an education thing for them to know that they need to get the testing done to do that next step. So. Education and communication are the key to all the progress that we're going to do in the next couple of years for various populations, I think.
And I'm certain that point is well taken, and I think well understood in the kidney community. And you probably heard about the CanSolve grant, which was awarded to a group of investigators in kidney health headed by ADIRA, by ADIRA 11, and $57 million, and a huge chunk of that is going to looking at access and particularly focusing on the Aboriginal population, and you know, a lot of the barriers that they have, which you well outlined, and then the additional issue is that very much higher incidence of kidney disease, much more diabetes, double whammy because it runs in families, and then you know, and all the health risks that the person has, their family have too, and their access to living donation not necessarily being as good, and so this is this isn't a solution, but it's at least an intensive research effort to try and identify the barriers and then come up with some solutions.
I was just going to say, I can add a little bit to that because I also work for the Tanaka Nation as their Aboriginal patient navigator at the hospital, along with being a renal social worker. So in our communities, a lot of our Aboriginal peoples aren't being diagnosed with chronic kidney disease until they're in their later stages. And part of that is, part of it is poverty, getting off the reserve and getting into the kidney clinics would be one barrier. that we're working on. Another one is awareness and education, because we have a couple of patients that were, what do you call it? They were just skydived into, parachuted, that's the word I'm getting tired, but anyways, they parachuted in and started on dialysis. One has received a transplant, the other one is still waiting because there is health complications there. So what I did is I organized a meeting, the nephrologist over the telerenal nephrologist was available, and a couple of the nurses. And the patient had the whole community gathered with some elders. And because they were about an hour and a half away from Cranbrook where we did it, they all dialed in through teleconference. So it was great. And I think that just the fact that they became engaged and received some education on what this individual was going through. And they understood a little bit more about why he had to be careful with his diet and why he couldn't do this or that anymore and was working towards getting a transplant. They knew nothing, that community knew nothing about the kidneys when we first started. And so another thing I've been doing is attending the health fairs. So a renal nurse will come out, and I'll wear both hats at those. And the renal nurse will come out, and we actually do some testing. We'll do a urine dip and education about the kidneys and chronic kidney disease, and going to your doctor, the questions to ask your doctor, get your kidneys checked, and things of that nature. And it seems to be making a bit of a difference in the communities there. Yeah.
Fantastic. Well, I think I'll invite Dr. Landsberg up to just next step and wrap it up. Thank you all for coming.